Hello guys, welcome back to my YouTube channel. From this video, I will discuss about the anatomy of larynx. So first we will see what is the importance of larynx. Larynx is the upper part of the respiratory tract. Its main function is to protect the lower respiratory tract. Therefore, the foreign bodies do not enter into the trachea. When a foreign body comes in contact with the mucosa of the larynx, what happens is there is violent coughing and the foreign body is expelled out. And also there is another function of larynx that is the production of voice. So we call this also as the voice box. When we talk about the framework of the larynx, it is composed of cartilages and membranes. And let's see what is the location of larynx. Larynx is located in front of the neck, opposite the third to sixth cervical vertebrae in adults. That means from third cervical vertebrae to sixth cervical vertebrae. It moves vertically ups and down during swallowing and phonation. The larynx extends from the upper border of the epiglottis to the lower margin of the cricoid cartilage, and it opens in the laryngopharynx through laryngeal inlet and continues with the trachea below. The anterior aspect is covered with the skin, fascia and the strap muscles. Those strap muscles are omohyoid, sternothyroid and sternohyoid. The posterior aspect projects in the laryngopharynx. There are several differences in adult and infant larynx. The infant larynx is smaller and it's like a funnel shape and narrower than adults, about one-third the size of the adult. The laryngeal cartilages are softer and collapse easily in an infant. The laryngeal cartilages are soft. And also, the larynx is placed at a higher level in infants. Its upper margin is at rest and at level of axis vertebrae, and that of the elevated larynx, it is at the level of median atlantoaxial joint. In infants, the epiglottis is longer and deeply grooved, which is more suited to project air passage during suckling. I think this picture is also very clear. In a child or an infant, you can see the funnel shape very clearly, funnel shape of the larynx, and in adults it is cylindrical in shape. When we talk about the submucosa in infant's larynx, it is thicker and becomes edematous faster after irritation. Therefore, the obstruction of the airway takes place faster in the infants. Those are few differences between the adult and infant larynx. Next, we will see the laryngeal framework. When we talk about the laryngeal framework, it is composed of the cartilages and membranes. There are 6 types of cartilages. Those 6 types of cartilages are the 3 unpaired cartilages and the 3 paired cartilages. Here you can see, I will show you the framework. Here is the anterior aspect of the larynx and here is the posterior aspect of the larynx. From the anterior aspect, you can see the epiglottis, hyoid bone, thyroid membrane, then thyroid cartilage, then cricoid cartilage and the cricothyroid ligament. You can see 3 cartilages from the anterior aspect. Those 3 cartilages are the epiglottis, thyroid cartilage and the cricoid cartilage. Those 3 are the unpaired cartilages of the larynx. In between those 3 cartilages, you have these 2 membranes, thyroid membrane and the cricothyroid membrane. This is the posterior aspect of the larynx or the interior aspect of the larynx. You can see the epiglottis here. Here is the epiglottis. Here is the thyroid cartilage from posterior aspect and here is the cricoid cartilage. Here you can see 3 paired cartilages. This is arytenoid cartilage. These two are the Arytenoid cartilage. Here there are two cartilages as corniculate cartilage. Corniculate cartilage. Here the other one, the cuneiform cartilage. Here there is a small one, cuneiform cartilage. Here these two are cuneiform cartilage. These two are corniculate cartilage. And then this is arytenoid cartilage. Those are the three paired cartilages. Next, we will discuss in details about these 6 cartilages separately. First, we will see about the thyroid cartilage. Here is the thyroid cartilage and the anterior aspect. Here, this area is the laryngeal prominence or the Adam's apple of males. And here is the superior cone of the thyroid cartilage. Here is the superior cone of the thyroid cartilage. Here is the inferior cone of the thyroid cartilage. Here superior cone and the inferior cone of the thyroid cartilage. From the laryngeal cartilages, thyroid cartilage is the largest cartilage and it is made up of hyaline cartilage. Therefore, it tends to calcify and ossify when the age advances. You have to remember that thyroid cartilage is made up of hyaline cartilage. And here you can see the lateral view. Here is the thyroid cartilage and the superior horn, inferior horn, and this is the oblique line. This is the oblique line. This is the laryngeal prominence of the Adam's apple. Or we call this as thyroid angle as well. In the thyroid cartilage, these are the quadrilateral lamina. These two quadrilateral lamina meet in the midline and anteriorly at the thyroid angle, but leave the thyroid notch between them above. When we talk about the interior aspect of the thyroid cartilage, here is the superior view. Here is a thyroid cartilage. Here is the anterior aspect and here superior horn can see. So the internal aspect of the thyroid angle is covered with mucosa of larynx and gives attachment in the midline to thyroepiglottic ligament, bilateral vestibular ligaments and bilateral vocal ligaments from above downwards. From above downwards there are thyroepiglottic ligament, bilateral vestibular ligament and bilateral vocal ligaments. You can see only bilateral vocal ligaments. These are the bilateral vocal ligaments. Lateral to the vocal ligament, it gives attachment to thyroarytenoid and vocalis muscle. Here is the vocalis muscle and thyroarytenoid muscle. The upper border of the thyroid cartilage is correspond to the C4 vertebra and the lower border correspond to the C5 vertebrae. Next, we will see the epiglottis. When we talk about the epiglottis, it is a leaf-shaped elastic cartilage. I told you the thyroid cartilage is hyaline cartilage. The epiglottis is elastic cartilage. It forms the anterior wall of the laryngeal inlet and upper end project upward and backward behind this hyoid bone. You can see the hyoid bone here. And the upper end is free and broad. You can see free and broad. The lower end is narrow and pointed. There are two lateral margins here. And it has anterior and posterior surfaces. The upper part of the anterior surface is covered with the stratified squamous epithelium. Upper part of the anterior surface means this part anteriorly, and it is connected to the tongue by 3 mucosal folds. The lower part of the anterior surface is devoid of mucosa and connected to the hyoid bone by hyoepiglottic ligament. This is the hyoepiglottic ligament. Hyoepiglottic means in between hyoid bone and the epiglottis. That is hyoepiglottic ligament. Below this attachment, the anterior surface is separated from the thyrohyoid membrane. This is the thyrohyoid membrane. So the anterior surface is separated from the thyrohyoid membrane by pre-epiglottic space. It is a fat-filled space, pre-epiglottic space, in between thyrohyoid membrane and the epiglottis. You have the pre-epiglottic space which is filled with fat. The lower end is attached to the inner surface of the thyroid angle by thyroepiglottic ligament. When we talk about the posterior surface, the upper part of the posterior surface is composed of stratified squamous type epithelium, and the lower part of the posterior surface is composed of respiratory epithelium, that means pseudostratified columnar ciliated epithelium. The branches of internal laryngeal nerve pierce the mucosa on this surface. Next, we will see the cricoid cartilage in detail. Cricoid cartilage is the only cartilage only cartilage of the larynx that forms a complete ring around the cavity of the larynx. Its shape is like that of signet ring. Its broad lamina is posterior. It is posteriorly broad and anteriorly narrow. Here you can see anterior narrow and posterior broad. And the cricoid cartilage is composed of the hyaline variety, which is also as thyroid cartilage. The epiglottis is elastic cartilage, and because it is made up of hyaline cartilage, it is more prone to calcify and ossify when the age advances. And also, this cricoid cartilage is a very important landmark. It corresponds to C6 vertebrae. It corresponds to C6 vertebrae, and at this level, pharynx ends and it continues as the esophagus. At this level, pharynx ends and it continues as the esophagus, and also larynx ends and it continues as the trachea. Pharynx continues as the esophagus and larynx continues as the trachea. The landmark of separation is the cervical C6 vertebra, and it is the only laryngeal cartilage that articulate with the thyroid and arytenoid cartilages to form bilateral synovial joint. It is the only cartilage. This cricoid cartilage is the only cartilage which articulate with the thyroid and arytenoid cartilages. And therefore, cricoid cartilage is crucial for the movement of vocal cords as well. And also, it denotes the level of middle cervical sympathetic ganglion, and inferior thyroid artery enters the thyroid gland at this level. And also, the recurrent laryngeal nerve enters the larynx behind the cricothyroid joint. Here you can see the cricoid cartilage. Above the cricoid cartilage, in between thyroid and cricoid, you have the cricothyroid ligament here. Lateral cricothyroid ligament, median cricothyroid ligament, lateral cricothyroid ligament. In the combination with the conus elasticus, we call it as cricovocal membrane. And here you can see the below the cricoid cartilage, you have the cricotracheal ligament. And also you can see the cricothyroid joint here. Cricothyroid joint in between cricoid cartilage and the thyroid cartilage. There is a joint, cricothyroid joint. Let's see the three paired cartilages. First one is the arytenoid cartilage. You can see the arytenoid cartilage here. It is like a three-sided pyramid. It has a base, apex, and two processes. Here is the apex. This area is the apex, and these are the two processes. You can see this is the vocal process, and this is the muscular process. This is the muscular process. To this muscular process, there are two muscles inserted or attached. Those are lateral cricoarytenoid muscle to the arytenoid cartilage and the cricoid cartilage, lateral cricoarytenoid muscle. Then here posterior cricoarytenoid muscle. That means to the arytenoid and cricoid. Posterior cricoarytenoid muscle. Lateral cricoarytenoid, posterior cricoarytenoid. Here you can see the vocalis or the vocal process. To the vocal process, it is anteriorly projected, and the vocal ligament is attached to this vocal process, and also here vocalis muscle is there. Vocalis muscle is also attached to the anterolateral surface. Here is the anterolateral surface of arytenoid cartilage. To this anterolateral surface, this is the vocalis muscle which is attached, and this is the thyroarytenoid muscle. Thyroarytenoid muscle. And also on the apex, you have the corniculate cartilage. Apex articulate with the corniculate cartilage. Here is the corniculate cartilage. These are the corniculate. I mentioned about the vestibular ligament when I mentioned about a vocal ligament. So the vestibular ligament is also attached to this vocal process, but just above the vocal ligament. This is the vocal ligament, and just above this, you have just above the vocal ligament, you have the vestibular ligament. Remember that very carefully. Just above the vocal ligament, you have the vestibular ligament. I hope this diagram is more clear. Here you can see the cricoid cartilage, and here you can see the thyroid cartilage. Actually, here how we identify anterior and posterior. Here is the anterior, here is the posterior, because I told you in the cricoid cartilage, the posterior aspect is more broad posterior aspect is there, and the anterior aspect of the cricoid cartilage very narrow. I told you previously. So this is posterior and this is anterior. Here you can see the vocal ligament. This is the vocal ligament. This is the vocal ligament, and here you can see the vestibular ligament. Here vestibular ligament is there just above the vocal ligament. This is the other one. This also should becomes like this, and it is cutted to see the other vestibular ligament. So again I will show you, this is the vocal ligament and this is the vestibular ligament just above the vocal ligament. Here when we look into this interior aspect superiorly, this is the vocal ligament and this is the vestibular ligament. It is more superior than the vocal ligament. This one is the vestibular ligament. Then these two, the cuneiform cartilages. These are the cuneiform cartilage, and this is the corniculate cartilage. Those two cartilages are elastic cartilage, made up of elastic cartilage, and also those two supports the epiglottic fold of their site. So that's all about the cartilaginous framework of the larynx. I hope you are clear with the 6 cartilages in detail. I will discuss about the membranes, ligaments and muscles, and also the most important thing is the function of vocal cords and the nerve supply, recurrent laryngeal nerve, and what happens when there is recurrent laryngeal nerve palsy. Those things I will discuss in another video. So thank you for watching.